welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman, and here is what I bring to you all from the world of medicine. COVID-19 and its adverse effects on diabetic people. Patients who contract COVID-19 face a higher risk of developing cardiovascular diseases and diabetes, particularly in the 3 months following infection, according to a new study published July 19th in the open access journal PLOS Medicine. In the new study, researchers investigated whether a sample of COVID-19 patients developed new cases of diabetes and cardiovascular diseases at higher rates than a sample of people who have never had the disease in the year following infection. They analyzed anonymized medical records for more than 428,000 COVID-19 patients and the same number of control individuals matched by age, sex, and family practice. The analysis showed that COVID-19 patients had 81% more diagnosis of diabetes in the first 4 weeks after contracting the virus, and that their risk remained elevated by 27% for up to 12 weeks after infection. COVID-19 was also associated with a 6-fold increase in cardiovascular diagnosis overall, mainly due to the development of pulmonary embolism or blood clots in the lungs and irregular heartbeat. The risk of a new heart disease diagnosis began to decline 5 weeks after infection and returned to baseline levels or lower within 12 weeks to 1 year. The researchers concluded that COVID-19 infection is associated with an increased risk of cardiovascular disorders and diabetes, but fortunately there does not appear to be a long-term increase in the incidence of these conditions for patients who have contracted the virus. Based on these findings, they recommend that doctors advise their patients who are recovering from COVID-19 to reduce their risk of diabetes through a healthy diet and exercise. Childcare stress, burnout, intend to leave the job among healthcare workers during COVID-19. The findings in JAMA Network Open suggest there is an association between reporting high childcare stress and burnout, and programs to reduce childcare stress may be beneficial for workers and health systems. This survey study, Coping with COVID, a brief work-life and wellness survey of US healthcare workers, was conducted assessing childcare stress, burnout, anxiety, depression, workload, and work intentions. The survey was distributed to clinicians and staff in participating healthcare organizations with more than 100 physicians. In 208 organizations, physicians 26.9%, nurses 19.5%, women 67.1%, and white participants 57.9% responded with a median organizational response rate of 32%. Childcare stress was present in 21% of healthcare workers. Childcare stress was more frequent among racial and ethnic minority individuals and those not identifying race or ethnicity versus white respondents 25.2% versus 18.8%, and among women versus men, that is 21.1% versus 17.9%. Those with childcare stress had 115% greater odds of anxiety or depression and 80% greater odds of a burnout versus individuals without childcare stress. High childcare stress was associated with 91% greater odds of intent to reduce and 28% greater odds of intent to leave. In this survey study, childcare stress was disproportionately described across different subgroups of healthcare workers and was associated with anxiety, depression, burnout, intent to reduce, and intent to leave. Addressing childcare stress may improve healthcare workers' quality of life and healthcare workers' retention and work participation. The drug rosuvastatin and kidney damage. Statins can effectively lower high cholesterol, and many individuals take rosuvastatin, one member of this drug class. New research based on patient health records and published in JASN suggests that rosuvastatin, especially at higher doses, may have damaging effects on the kidneys. Reports had linked rosuvastatin with signs of kidney damage, that is hematuria, blood in the urine, and proteinuria, protein in the urine, at the time of its approval by the US Food and Drug Administration. But little post-marketing surveillance exists to assess real-world risk. To investigate, researchers analyzed electronic health record data for 152,101 new users of rosuvastatin and 795,799 new users of another statin called atorvastatin. The team identified hematuria in 2.9% of patients and proteinuria in 1.0% of patients. Compared with atorvastatin, rosuvastatin was associated with an 8% higher risk of hematuria, a 17% higher risk of proteinuria, and a 15% higher risk of developing kidney failure requiring replacement therapy such as dialysis or transplantation. Risk of hematuria and proteinuria was higher with a higher dose of rosuvastatin. Also, among patients with advanced kidney disease, 44% were prescribed a higher dose of rosuvastatin than the US FDA recommends for individuals with poor kidney function. Researchers concluded that the higher risk of hematuria, proteinuria, as well as kidney failure with rosuvastatin use and similar cardiovascular benefits between the rosuvastatin and atorvastatin groups. Because rosuvastatin may cause proteinuria and hematuria, especially with high-dose rosuvastatin may not merit the risk even if small, particularly for patients with advanced kidney disease. Hormone replacement therapy. A new paper in the Journal of the National Cancer Institute published by Oxford University Press finds that menopausal hormone therapy for breast cancer survivors is not associated with breast cancer recurrence, despite worries among some researchers and physicians. Hot flushes and night sweats, as well as vaginal dryness and urinary tract infections, plague breast cancer survivors frequently. These symptoms worsen the quality of life and can lead patients to discontinue therapy. These symptoms may be alleviated by vaginal estrogen therapy or menopausal hormone therapy. However, the safety of systemic and vaginal estrogen use among breast cancer survivors, particularly those with estrogen receptor positive disease, has been unclear. Among 8,461 women who had not received vaginal estrogen therapy or menopausal hormone therapy before a breast cancer diagnosis, 1957 and 133 used vaginal estrogen therapy or menopausal hormone therapy, respectively. After diagnosis, the researchers here found no increase in the risk of recurrence or mortality for those who received either vaginal estrogen therapy or menopausal hormone therapy. This large cohort study helps to inform the nuanced discussions between clinicians and breast cancer survivors about the safety of vaginal estrogen therapy. These results suggest that breast cancer survivors on tamoxifen with severe genitourinary symptoms can take vaginal estrogen therapy without experiencing an increase in their risk for breast cancer recurrence. However, caution is still advised when considering vaginal estrogen for breast cancer survivors on aromatase inhibitors or when considering menopausal hormone therapy. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.